Thank you very much, Richard. And I'd first like to thank the Allison Hunter Memorial Fund and also the Invest in ME and Richard and Pia for setting this whole thing up. It's been a wonderful conference, and it's because of you that we're all brought together here, and we really want to thank you very much for doing this, and all of you that have volunteered to put this on. And so today was the scientific meetings, and tomorrow the patient community is going to hear what the researchers have to say and everything that they've been doing. And I'm kind of here to pull it all together. I am part of the Open Medicine Foundation. Andy Kogelnick at the Open Medicine Institute has asked me to join him at the Open Medicine Foundation, and we're going to kind of tell you what our plan is and what we're working on and bring you up to date. So there is a big plan, and the scientific community has gotten together at a meeting for making a scientific agreement, a well thought out scientific agreement that really will move this forward. And we all know that you really can't do anything on a local or national level. This is an international problem. We need to have an international focus. So this is what we're going to talk about today. So the theme is collaboration and hope to conquer ME/CFS. And tonight I'm going to call it ME. As quoting Helen Keller, "Alone we can do so little, together we can do so much." For patients with chronic ME, we need to have research for treatments, effective treatments. For those that have just begun, we need to find biomarkers, diagnostic tests. And for those that haven't had it, we want to make sure that they never get this life-debilitating, horrible disease ever, or even know about it. Collaboration was missing 7 years ago when our 16-year-old daughter came down with some unknown mystery illness at 8:20 in the morning on September 7th. It was her heart. We took her to the emergency room. What is going on? We didn't know for months. We went to many doctors, still didn't know for months. I started going to conferences. I started going to anywhere and studying anything I can. Once she was diagnosed with CFS, I started going to ME/CFS conferences and to try to find out, what am I missing as a parent? What am I missing? What's out there? Well, I left without hope, and this was 7 years ago. I left without hearing the words joint effort, collaboration, let's do this together. And I thought, you know what, I'm not going to keep leaving my daughter and going to conferences anymore. I don't see anything that's going to help her, herself. But now it's different. Things have really accelerated, and I'm really excited. So in the last few years, things have accelerated in the right direction, and people are starting to collaborate. It's wonderful that there's so many organizations all over the world, and so many patient support groups now all over the world that are really spending time and effort trying to get to know each other, trying to find answers, and really communicating with each other. And it's wonderful that there's multiple institutions around the world doing research in ME. So now it's time to connect the dots. Last June, we had a phenomenal breakthrough. We had a meeting in New York City, a 2.5-day meeting of scientific experts that got together and discussed what could we do to solve this problem. What came out of it and what was born was the OMI Merit Initiative. The OMI, Open Medicine Institute, founded by Andy Kogelnick, Merit, Myalgic Encephalomyelitis, Roundtable on Immunology and Treatment. This particular group expanded in time, and it is now 27 scientists from 11 different countries. It's a large plan. It's a big plan. And what they did was they sat at a round table, whiteboarded about 35 or so different ideas, everybody from their specialty, everybody sharing, let's get this done. Then we had to vote and come up with possibly the top 10, because we can't fund everything all at once. So we want to pick the most urgent type of research projects that will move this forward. And then we take the next step. So we came up with a top 10 list, top 10 projects, and this is what we're calling the OMI Merit Initiative. You'll see more of this information and the details in the journal tomorrow and also on our website, and I'm going to read you a few of the things that we're doing. But this comprehensive plan by the group of scientists that put this together is the best chance and the best in history that we have had so far to really understand what the underlying process is for ME with regard to infection, immunology, and genetics. When I sat sitting at the meeting, I just sat and listened in awe, and it really gave me hope for the first time that we're really going to be moving this project forward. And I thank some of you that are here tonight that are part of it, and I really appreciate what you've done, and I encourage others to join our process. As some of you already know, the OMI Merit Initiative includes some of these projects. 150 to 300 patient international clinical trial for rituximab and valganciclovir. A registry and biobank including an unlimited international registry and detailed 1,000 specimen survey. A protein panel study including over 250 patient samples to be run on a detailed array of protein platforms. Several mono and combination treatment pilots. 2 extensive immunologic biomarker exploration studies. DNA genetic studies that's been funded and is just about to start, and I'll tell you more about that. Measurements to begin to establish an underlying and understanding of the contribution of nutritional and environmental factors in ME. Comprehensive viral testing. Pilots for natural and over-the-counter substances. After we had the meeting, Andy Kogelnick asked me, he said, now we have this plan, this big plan. Now we have to fund it. Will you help me do this? So I said, yes. So here I am. We're on our way, and I want to tell you what's going on. First of all, the Open Medicine Institute has received a large grant from the Edward Evans Foundation to begin the study of genetics and the extensive exploration of genes and their contribution to this disease. We're grateful to them for launching us in the research, launching our OMI Merit Initiative, and getting us going. This grant will establish or refute the role of genetics in ME. And the study will include investigations in the HLA regions of the genome, DNA methylation, and other aspects, as well as whole genome sequencing. By the time the study is done, about 1,000 patients will have taken part, and we should have results within the next 12 months. It's fully funded, and we're beginning it already. Support has come from other donors, from other fields. For diseases as complex as ME, we need to have a large IT platform. We have received a grant from the VMware Foundation. VMware are the experts in cloud computing, and they're going to help us increase our already open architecture that Andy Kogelnick has developed called OpenMedNet. And OpenMedNet is a data platform that will allow us to actually receive, gather, manage, and analyze hundreds of thousands of data points. VMware Foundation has given us money to be able to increase the capacity that it already is. It's already in existence right now. I know that many of you, like I have for my daughter, have piles and piles of medical data. I mean, piles. And I know that some of you, as I did, stopped and put everything on spreadsheets and made summaries to take to your doctors, 20 doctors, 30 doctors, however many. And I would have loved to have OpenMedNet to be able to have entered our data and just show up at a doctor's office and say, you can look online and look whatever you want. Instead, we took everything with us just in case they wanted to see 1 or 2 tests that I didn't put on the summary or read what I wrote. And so this is really a tool that patients will be able to use all over the world. It's free for them to use for their own medical records and then to help us with our research gathering. Using this process, using the OpenMedNet, Andy Kogelnick has been funded by the CDC to continue to collaborate with the top clinicians in the United States, and they're trying to see if and how diagnosing patients differ from clinic to clinic. Gathering hard data to address the issue of case definition and to find the best ways of measuring this illness. It includes about 450 patients. Another funded project of the OMI is my pet project, and it's an alternative therapy called Moringa oleifera. I saw a few patients be helped by this particular alternative therapy, so I couldn't leave it alone. So my private foundation, NIDA, Neuroimmune Disease Alliance, we had fundraisers, we funded this, and we're going to get this going. And it really sets it up for us to be able to do low-budget type pilots to see if certain candidate substances are worth trying and worth pursuing. I came here to London to tell you about the global collaboration that began with the OMI initiative and tell you that we have a chance for serious solutions and that there's really hope. So what will it take to move this forward? So the Merit Initiative budgeted about $13.5 million American dollars plus overhead. And so far we've received about $1 million towards the projects that are on the list. So we've received about 10 to 15% of what we need to complete the entire project initiative. So if the CDC estimates at least 8 million patients around the world, and if each of those patients put in $1.56, we'd be able to fund the whole thing. But in the meantime, The OMI and the OMF are working very hard, trying to apply for grants with industry, corporation, pharma, philanthropic, and private foundations, patient community, patient organizations. And we make it very easy to donate on our website with just a credit card. And we had a student a couple months ago from George Washington University in Washington, D.C., and she was a top volleyball player. She had a volleyball tournament in honor of her aunt who has ME, and she raised $3,000. So we're encouraging through Facebook, through social media, for people to do this all over the world. It just takes that little bit, little, adds up to a lot, because we have a lot of people that have ME and a lot of advocates for them that say, what can I do for you? Well, you can go on a walk. You can run a marathon. We're spending a lot of time, the Open Medicine Foundation. I have volunteers working with me, and we are approaching large foundations. We're actually teaching them what is ME/CFS because they don't know what that is. So we're approaching foundations that use their foundations and like to fund medical research. And yes, they're random. Sometimes we have connects. We're looking for people who know people who have foundations. We have some people who've introduced us to some people. And also we're just doing our own research, trying to seek out foundations that are interested in funding medical research, because we're going to fund this. So what can you do individually with your patient organizations, scientific communities, family, friends, people who ask, what can we do to help? Number one, stand by us and join us in whatever ideas and whatever fundraising efforts you have to help us get at least this initiative done. It's a collaborative research project. If we get this done in the next 2-3 years, then we can move on to the next, or maybe we'll have the answers. Maybe that's all we need. Maybe it will just open up the right path for next time. Number two, and just as important, it's within your power to help us increase the data that we want to take a look at. We're looking to look at, we want you to share your medical information and research data so we can all, number one, be on a platform looking at research together, and most importantly for the patients and patient organizations, we're encouraging you to be part of this research and be part of the solution, giving us your medical data, all privacy laws abided and results encrypted, so we can gather hundreds of thousands of data points. So we have a platform, the Open Medicine, the Open MedNet. We have instructions in the journal that you're going to receive tomorrow, which shows you how to log on to that system. We'll have more information in the summertime. We're trying to make it a little bit easier for patient interaction to be able to enter easier than it is right now. And so we'll be emailing anybody who has signed up and also sending out information for people to sign up and sign on their medical record. If you want to use it as just your own medical record, you may, and you can click the box that says, I want to be part of research. And we encourage you to tell all of your members of your organizations and anybody in your scientific community that the more data points we have, the quicker we can find some answers within the data itself. The other thing I want to ask is, on our website, Open Medicine Institute, we have a sign up for the newsletter. It's free, it's an e-newsletter, and the more people who sign up, the more people that I can communicate with, let them know what research is happening, what is funded, what's on the table, and what the results are. And most importantly is to give the patients hope. I'm visiting with some of the patient support groups in and around my area where I am and around the OMI, and the most important thing I'm giving them is hope. Something is happening. Something is going on that's real, and we'll have some answers. And hope is a big medicine. Researchers sharing data and physicians sharing successes, patients sharing their history, and organizations getting their members to join in the research effort will make this go faster. And my own personal passion and purpose right now is to find a cure for ME, and better yet, a prevention of ME. And I can leave after today's meetings knowing that collaboration is now underway. Thank you very much. Thank you.